My name's Neil. I'm going to be your nurse today. What is your name and date of birth?
Georgina Collage, 9/11/97.
Alright. Do you have any allergies?
No.
And do you have any pain?
No.
Alright. I'm going to wash my hands and I'm going to put some gloves on. I'm going to make sure the patient has some privacy. And then I am going to just check your overall appearance, level of consciousness, how you're dressed, your posture. And then at the same time, throughout the assessment, I'm just going to be checking your skin. I'm going to check for temperature, color, edema, redness, swelling. Also going to check for moisture. I'm going to check if there's any lesions or masses. I'm going to check for asymmetry, border, color, diameter, and if it's evolving as well. And then I'm also going to do a neurological assessment on you. Do you know who the president is?
Yeah, Biden.
Alright, and then do you know what season it is?
Yeah, winter.
Okay, and then what day is it?
Monday.
And do you know where you are?
Yes, you're perfect.
Okay, and alright, perfect. And then I am going to check your vitals first, if that's okay. I'm going to start off with your pulse, and I'm going to take your pulse ox first. I'm going to put that on your finger. Is it okay if I touch you?
Yes.
Okay, so I'm going to grab your finger, put the pulse ox, measure that. I'm going to also check your pulse on your wrist here, and I'm going to do that for 60 seconds and assess that. And then at the same time, I'm going to be assessing your respirations, checking for your chest movement. Alright, perfect. Let's see. I am going to start with your head here. I'm going to inspect your head and scalp. I'm going to palpate, check to make sure it's normal cephalic, and then I'm going to check your TMJ. I'm going to open your mouth and close it. Perfect. And then I'm going to inspect the ears. I'm also checking for symmetry. And then in the ears, I'm going to check inside the ears, make sure there's no foreign objects or anything, both ears. And then I'm also going to assess the eyebrows, eyelashes, eyelids. And then I'm going to palpate the sinuses here. And then under the eyes, palpate the nose. And then I'm going to look at the lips. And then I'm going to have you smile. I'm going to look at your teeth. I'm going to have you say ah. I'm going to look at your gums and your tongue. And then I am going to check your eyes real quick. Thank you. That's okay. Alright, so I'm going to shine this light in your eye, but you're just going to look straight for me. I'm going to check for constriction and make sure they're symmetrical. Both eyes, and the next one. Perfect. And then I'm going to have you follow your eyes with this light. Perfect. And now I'm going to check your blood pressure real quick. Actually, first I'm going to check your temperature, then your blood pressure. Okay, 98.5. Go ahead and check your blood pressure. I'm going to make sure her legs are not crossed. Do you have to use the restroom?
No.
Okay, I'm going to have your arm on here, have you relax, make sure it's not above your heart. And then, let's see here. Make sure this is the right cup size. It looks like it's the right one for her. Okay. Put this on real quick. Over 82. Okay. And then I'm also going to check your capillary refill, make sure it's less than 2 seconds. I'm also inspecting the nails for cleanliness and everything like that. And then I'm going to have you touch your nose and then touch my finger. And I'm going to have you close your eyes and I'm going to touch a part of your body. You just let me know where I'm touching.
My left thigh. My right arm.
Okay, perfect. And then keep your eyes closed and I'm going to draw a letter in your hand. Let me know which letter I write.
D.
Okay, perfect. And then let's see here. I'm gonna have you touch your shin, your heel to your shin, and slide down. And slide down. Perfect. Perfect. Okay, and then I am going to have you touch your fingers like this, both hands. I'm going to have you grasp my fingers for strength. Perfect. And then, let's see. Okay, make sure that's everything on that. And then I'm going to check your, I'm going to check your neck mobility. I'm going to have you put your ear to your shoulder, other side, and then have you look up. And then look down, and then side to side. Okay, perfect. I'm going to palpate your neck. I'm going to check for masses and check your thyroid as well. Okay, perfect. And then I'm going to check your carotid arteries, look for bruits. Both sides, perfect. Alright. And then, let's see. Next, I am going to have you stand up real quick. Okay, and then have you close your eyes. Just stand there for me. Make sure, perfect. Okay, and then I'm going to have you walk with one foot in front of the other. Perfect. And then on the way back, I'll have you just walk regular. Okay, you can have a seat. And then I'm going to check your heart real quick. I'm going to listen. I'm going to look at a couple points. I'm going to look at the aortic valve, pulmonary, Erb's point, tricuspid, and then as well as the mitral. And then S1 and S2 sounds can be heard best at the apex of the heart, and then the PMI is located mid-intercostal, mid-clavicular, fifth intercostal. And I'm going to listen for 60 seconds for the heart rate. And then I'm also going to just check for your skin trigger under your clavicle here. Okay, and I'm going to have you stand up, and I'm going to listen to your lung sounds. And back. Perfect. Going to start on the left upper area. And then I'm going to palpate your spine, checking for scoliosis, kyphosis, or lordosis. I'm also going to check for kidney function here, just pressing gently. Okay, and then I'm going to have you turn this way. I'm going to have you lean back a little bit, and then lean forward, touch your toes. Okay, perfect. And then I'm going to have you lean to the side. There we go, and then other side. Perfect. And then I'm just going to assess some of your joints as well, so I'll have your face towards me. Just going to lift your arm, checking for crevice, redness, swelling, anything like that. Other side as well. Okay, and then checking the elbows for mobility, checking the wrist as well, fingers, other elbow, wrists, fingers. And then I'm going to have you put your arms out to the side, push up towards my arms, push down towards my hands, and then I'm gonna have you bend your arms like this. I'll push towards you, push towards me. Okay, and then I'm gonna have you check your hip mobility. Hip out to the side, hip out to the other side, bring it forward, other one forward as well. And then also you can do the ulnar radial, so just go like this, like you're shaking someone's hand. Yep. Or waving, yep. And then just do the inversion, eversion, both legs. Perfect. Okay, and then I'll have you sit down real quick. Alright, I'm gonna have you push your thighs up towards me, and then to the ground. Alright, then towards you, then towards me. Perfect. Checking for pulses on the feet. Posterior tibial pulses for 60 seconds, and then I'm gonna have you push up towards my hands, push down to the hands, and then I am going to also check for the reflexes. Usually they'll be on a higher table with their feet hanging. Okay. Okay, and I'm also going to check on here as well. Relax. Okay, other side. Okay, perfect. And then I am going to assess your abdomen real quick. I'll have you lay down. Okay, I'm gonna listen to each quadrant first. I'm checking for normal vowel sounds, or if they're hyperactive, or if there's absent vowel sounds. I'm gonna start with the right lower quadrant and then work my way around clockwise. We have normal vowel sounds. Also checking the umbilicus to see if it's concave, flat, or everted. And then I'm also going to palpate next, checking for masses, any tenderness, any pain, like that. Each quadrant, I'm going to list like 2 organs in each quadrant. So right lower quadrant, we have the appendix and the right ureter, or right ovary. Right upper quadrant, we have the gallbladder or liver. Left upper quadrant, we have the spleen or the stomach. And left lower quadrant, we have the left ureter and the left ovary. And then also I'm checking for any scars, any abnormal masses, the rib cage, and then also assessing the skin, checking for moisture, temperature, anything like that. And then you can sit up real quick. And then one thing I did miss is when we're checking for respirations, we're checking to see if they're using any accessory muscles, and just checking the expansion of the ribs. And I think that is it, I'm pretty sure. Just make sure I didn't miss anything. Yeah, good. Okay, I think I'm good.